I wanted to just take just a few minutes and to reiterate a couple of things that Michelle said. Number one, thank you for being here. I know that the work that you all are not being able to do today at your offices is not going to just miraculously go away. I wish it would, but it's not. So we know that you're taking time out of your day and spending it with us, and we appreciate that. And we're going to, as you can see by the people who are represented from our team and also from our partners, this is a very important thing that we do on a yearly basis. So we're excited to be able to put this on for you all and to give you more information about some of the programs and the benefits that we provide. You know, one of the main things I wanted to talk about was just, what we're seeing. And we're seeing a large trend in this healthcare space. I'm sure people read articles and see headlines from time to time that, people are expecting the healthcare cost to really increase these next couple of years more than it has been in the past. And we are partners with some people in this space, of course, and they're predicting double-digit trends for the next couple of years. And when you see that, it scares you because, our trend has been something that we've been able to manage for a long time, and we continue to work hard to manage that trend. And when you read that, sometimes you're thinking, that's something that's just out there in the industry. It's not going to impact or affect us, but it really does. I mean, we were meeting with some states a couple of weeks ago in our office from some surrounding states, and they were seeing rate increases of 7.7% and 12%. And these are states that are doing some fantastic things to really try to manage these costs. And then, of course, there's some counties and some cities in the state who don't have our insurance, and we're constantly communicating with them to make sure they know who we are and see if we'd be a good fit. And when we talk to them, they're also seeing double-digit trends as well. In fact, we're onboarding a county, in the next couple of months that is seeing that 10 or 11% rate increase. So, it's something that is not just something you read about. It's something that is actually happening out there in the space, even in the governmental type of contracts. So I just wanted to let you know about that. And, there's various things that entities can do to impact these trends. Of course, number one is to increase rates, and that's what many are having to do. And then the second thing is to decrease benefits. And I want to talk a little bit about those two things just very briefly. So, when it comes to rate increases, I think we've been able to communicate that historically over the 33 or 34 year period of our plan, we've been able to average a 4.2% rate increase. And that is something that's pretty much unheard of in this type of industry. And a lot of that credit goes to our team, but a lot of our credit goes to the board as well. The board has been trying to put things in place to be predictable, to be stable, and for you to be able to understand what may be coming up that next year. So they've done a really good job of being able to kind of maintain that trend level instead of seeing some highs out there like the industry has seen. And then, like I said, decreasing benefits. The last time we had a negative benefit change was 2021. And before that was 2016. So we've gone 10 years with only two negative benefit changes, which is fantastic. And of course, during that time period, we've been able to add benefits and been able to add programs. So we're excited to be able to talk about those things a little bit more. Like I said earlier, this conference is something that's very, very important to us. Michelle and her team puts in a whole lot of time to this. She may take off a few weeks after the last conference to kind of regroup, but shortly thereafter, she'll be meeting with her team again to think about how they can improve things next year. And it's pretty amazing because, we've been doing these for a while. Close to probably 10 years now together. And she has continued to make these better. She's continued to make these things be relevant and meaningful and well worth your time and our time. So, Michelle, I really appreciate the work that you put into these and your team as well. You do a fantastic job. And the other thing that I really enjoy is being able to, for our team to be able to communicate and talk to you all and for y'all to get to know us a little bit better, and also our partners. We do a lot of research on our partners. We do a lot of work with our partners. A lot of that's headed up by Jessica O'Donnell, our Chief Benefits Officer. And these partners of ours are the best of the best. We have vetted them all. There are numerous partners such as these in this space, and these are the ones who kind of have risen to the top of those lists. And we're excited to be able to let you all hear more about those this morning, because all these programs and partners that we have, you know, if the key to that is getting engagement. And if we can get engagement in some of these partners, Hinge Health, Verta, Wonder, you know, all the other ones that we have, it really will make an impact on not only, and most importantly, our members' lives, but also it benefits the plan as well, because these things are really geared to help people be healthier, to be more productive, and to be better employees. So thank you for your time this morning. We are excited that you are here. Thank you so much for taking time out of your day. And I'm going to turn it back over to Michelle.